Hello, everyone, and welcome to my YouTube channel. If you are a subscriber, thank you. And if you are joining me for the first time, welcome. Our topic for today is about mental health. And we have an expert today who is going to be answering a lot of our questions about mental health and also share some very important resources with us to take care of our mental well being. So don't go away, we will be right back. Welcome back. And as I said earlier, our topic for today is about mental health. Mental health is something that we need to talk about over and over to create awareness because there is a lot of stigma surrounding mental health. And over the years, it's been associated with shame and guilt. So today we have an expert who is going to talk to us about mental health and also help us with some very important resources. So without further ado, join me. Welcome my guest for today, Samantha Frederick.
Thank you so much, Vivian, for having me on your show. I truly appreciate it, and I'm glad that we're able to actually have this conversation.
So thank you, Samantha. I would like you to go ahead and introduce yourself to the guest so they know who you are.
Yes, so my name is Samantha Frederick, and I'm a social worker and a psychotherapist. I do run my own business where I do counseling, psychotherapy, case management, group therapy, individual therapy, family and individual therapy as well. And again, my utmost goal is just to help other community the best that I can, bring about awareness, bring about some form of change, and again, just continue to educate the community.
Oh, thank you very much. So before I proceed, I would like to find out how did you come about with a passion for mental health advocacy?
hmm So this all started years ago, where I've always, had that niche to help people, and the minute time I had found out that my brother had autism, that's when I, really wanted to kind of, dive into just the mental health aspect as well as autism. And, just going through about the ropes where I had a lot of, unanswered questions. I wanted to know more about mental health, just the state of, people's mental being, how that really, affects people's, view of reality, their perception of themselves, how they interact with the world. These are questions I didn't understand, and just more thinking about just the generational, trauma that we face, as people. Those are questions I really wanted answered. And I think when I really had that aha moment was when I started going to school, started doing more research, getting those questions answered, and really having a niche to help people. That's it really kind of sparked that. And me always wanted to kind of work for myself. I think that really sparked that because I wanted to just, bring about some sort of, awareness about, mental health. So that's where, that yearning and that desire came about.
Oh, that's really interesting. And it's so also great to see how much or how far you've taken your mental health to
Mm-hmm.
a lot of advocacy, especially in our Black community.
Mm-hmm.
So, my next question to you is like, as we usually see, the masses, they use physical things such as diving, hiking, or going on a walk or in a gym to remedy their mental health. So, would you say this is the true remedy for mental health, or how can you give us a true definition or differences, sorry, between mental and physical health, and how both of them are very vital to our well-being?
Mm-hmm. So when we think about, mental health, we pretty much think of a state of well-being. So we all have that. Just as how we all have, physical health, where we build muscles, we work out, we take care of our body, we eat healthy. We also have to take care of our mental health as well. it's not just about surviving, it's about thriving, enjoying life, having a sense of purpose, being able to manage, life's ups and downs. So mental health isn't just simply, the absence of mental illness, or living with a mental illness. It doesn't mean that you can't have good mental health even if you have a mental illness. Just like, for example, someone might have diabetes, or high blood pressure. It's the same way again, with that alignment with mental illness. So it's really, really important to take care of your mental health, because when you think about mental health, it's something that's abstract. You cannot see it, right? But we know that we all have that mental health state. So just as the same way as you work out, you eat healthy, you also have to take care of yourself mentally by perhaps doing different mental exercises, finding proper and healthy coping skills, being able to problem solve, being able to interact with society, interact with the world, interact with people, and being able to differentiate between mental health and mental illness, where mental, if you do not take care of your mental health, it can eventually lead to a mental illness. So just being aware that, hey, we all sometimes struggle with our mental health, that we do have rough times, but being able to remember that, when you do struggle with your mental health, you do have the bandwidth to actually overcome, as opposed to when you struggle with the mental illness, there are other things that are involved. So the two do align in the sense where, with your mental health, taking care of it, day by day, and in alignment with the physical health, where you do exercise and other activities to take care of yourself.
Oh, thank you so much. That's really good to know. And my next question I want to ask you is that there are so many mental conditions that exist out there, but I would like you to, highlight some of those ones that are very common in our Black community, and
Mhm.
also some of the signs and symptoms to look for.
Hmm. Okay, so within the DSM-5, there's over 200 classified mental illnesses. So there's quite a bit of disorders that are um, within that book. But within the Black community, there's about three or so that are quite pervasive and quite prevalent within the Black community. One being depression. So with depression, that particular individual sometimes feels extremely sad, or they just have a loss of interest in just various things. Some of the more common symptoms are feelings of sadness, emptiness, and hopelessness, just a loss of interest in normal activities. So swimming, maybe journaling, maybe spending time with family or friends, maybe going to church, maybe going to the movies. So they really lose an interest in these particular things. And as well as sleep disturbances. So they might experience insomnia, where they don't really sleep at all, or at the same time they might sleep too much, so more than 10, 15 hours a day. As well as they may sometimes have frequent or reoccurring thoughts of death, suicidal thoughts, or may sometimes attempt suicide. So that falls under the category of depression, which again is very, very prevalent and pervasive within our black community. And keeping in mind that depression looks very different among people, in the sense where a person can still be smiling, going to work, laughing, cooking, but at the same time, they are still experiencing depression. So it doesn't necessarily mean that, even though they might be sleeping 8 hours a day, it doesn't mean that they're not depressed, right? They can still show different signs of depression. Another one is anxiety. Anxiety is another, well-known mental illness within the Black community, which is again, it's with anxiety. There's about 7 or 8 different types of anxieties that cause nervousness, fear, apprehension, or sometimes worry. And with anxiety, it really affects how we feel and behave. It's an amalgamation of different types of mental illnesses. And, with anxiety, it's considered a problem when the symptoms really affect your everyday function, or in the sense where, your sleeping habits, your ability to get up and do what you have to do each day. So sometimes, we all experience those different signs of anxiety where, let's say you have to do a presentation, you might have those, those feelings in your stomach where you get those butterfly feelings. That's normal. But the difference is with anxiety is when it really affects your everyday function, right? So that's something to really keep in mind. And again, some of the symptoms are, nail biting, perhaps, pacing back and forth, sweaty palms, right? Heart palpitations, you know, those sorts of feelings, sometimes, stuttering. Those are some of the signs of anxiety. And because there's seven or eight of the different types of anxieties, once again, it looks different among all people. So those are just some of the signs and symptoms to kind of keep in mind when, experiencing anxiety. So once again, we all sometimes do have those anxious feelings, but the difference is when those symptoms really affect your function. That's something to really keep in mind. And another well-known mental disorder among the Black community is suicide. Now, this is one, again, it sometimes is very tricky because it can overlap with depression, where that person feels extremely hopeless and helpless, and they have a loss of interest within, the things that they usually enjoy. And then from that state of depression, they sometimes experience, suicidal thoughts, right? Or suicidal, ideations, or sometimes they may attempt suicide. Now, in this case, some of the signs are, again, being just keep taking it with a grain of salt, because sometimes, some of the signs can be tricky. But with this particular individual, sometimes they give away a lot of possessions. They might give away money, clothes, lots of food, things of that sort. Now, keep in mind, there are people who have a natural gift to give, right? But keeping in mind, doesn't mean that they suffer from suicide, right? But
Yeah.
right. So again, this particular individual, they really withdraw. They tend to isolate themselves from people, from things. They might talk about feeling trapped, or feeling, or being, just the word, just feeling extremely heavy. So just keep in mind, just some of those signs and symptoms of an individual who may suffer, from suicide. A lot of times people do suffer in silence. So keep in mind some of those gestural cues as well. Sometimes they're not verbal. They are just, based off of their actions and how they interact with people. So keep in mind, of those different types of signs and symptoms with those two different types of mental illnesses.
Oh, that is really great that you've gone real in depth to tell us about some of the signs and symptoms to look for. And it's kind of like what you said is kind of tricky sometimes, that people who go through mental challenges, they try as much as possible to act as if they are normal. So it is always important for us to check out some of those non-verbal cues, see if what they are saying or what they are doing matches what they are saying, because they can be doing something different and saying something different. So it's
Mm-hmm.
always good to pay attention to all those. Thank you so much, Samantha. That is really, it's really good because to know, because sometimes we live around our loved ones and they go through mental challenges and we never
Mm-hmm.
know. It got to the point when some of them even go to the extent of destroying themselves, cutting themselves, or committing suicide. So with
Mm-hmm.
all these examples you've given and the signs and symptoms, it's always good to look for one another, check on your loved ones, call them if you don't hear from them, and see what's going on with them, and always ask questions too. I think that is also very important for
Mm-hmm.
us. That way you're able to evaluate to see if they are really okay. Wow, that's
Mm-hmm.
really interesting. So,
Mm-hmm.
just through doing some research about mental health,
Mm-hmm.
I found out that it is very prevalent for young teenagers or young adults between the ages of 15 and 25. So
Mhm.
why is it prevalent around on that age group as if compared to other age groups?
Mm. Well, amongst adolescents, again, they're faced with so many, various factors that impact their mental health. The sense where think about, just increased stress, fear and anxiety, right? Going to school. How does school really affect them? For instance, doing a test, right? They may have high goals, high achievement goals as well, and let's say, peradventure they don't do well on that particular test, they might internalize a lot of negative thoughts, right? So those are some ways, how that can really affect them at school. Just thinking about, being a teenager living at home, right? And again, during that age group, there's a lot of friction and tension between, parents and adolescents, right? They want to be independent, they want to explore, they want to experience, but at the same time, parents who understand, at that time how the world works, right? So again, sometimes they might, experience negative family environments, peradventure if their parents, just are maybe abusive. Parents might be involved in substance abuse, any form of abuse, emotional abuse, physical abuse, spiritual abuse. How can that really affect, an adolescence? And again, sometimes, being mistreated, from their parents or any form of, guardian of that sense, and so just thinking of how various factors really impact them. Sometimes they don't have the bandwidth to really cope in that sense. And again, they're at the age where they are involved in relationships, and they have close friendships and just wanting to fit in, during that time. And just going back, just thinking of how COVID has really affected them. Some of them have lost their jobs, right? That was their only source of income. So how has income and income, distribution really affected, adolescents? So those are some of the reasons why, mental health has been so ubiquitous amongst adolescents, is because just being able to have to deal with these various factors.
Oh, wow. So, is there any advice you would give to parents or
Mhm.
guardians who are dealing with their young or loved
Mhm.
ones who are battling or struggling with mental illness?
Mhm. Support. That is huge. Being a support system helps them having an environment where they feel safe, being able to vocalize, hey, mom and dad, hey, guardian and uncle, I'm feeling, kind of depressed. I'm feeling stressed out. I'm feeling like, a lot of these, different activities that I'm involved in are kind of heavy. So a support system is very, very important because they need that at that age. Be non-judgmental, right? When a youth is in a safe space, they tend to be more vocal as opposed to someone being extremely judgmental. So being able to, not judge the experiences that they are experiencing, even if you don't really concur with what they're saying, at least be, non-judgmental and kind of hear them out, right? That is their story. That's their narrative. That is their experience, right? And sometimes, we want to kind of see people through our eyes, and sometimes, vicariously live through people. But being that, support system, non-judgmental, and if you do have the wisdom, guide them in the right direction. If you're not really familiar with, mental health or mental illnesses, refer them to, appropriate and healthy resources. That's really, really important. And sometimes there are parents who aren't really cognizant of what mental health looks like, some of the signs and the symptoms. It is good to educate yourself, and if need be, refer them to a professional to get that help.
Oh, that's good. Educate
Mhm.
yourself and also refer them to
Yes,
professionals. And
yes.
I enjoy the part you said, be open to them, listen to them, because if they know that you are a safe person, that they can talk to you, they will tell you what they are going through. Wow. So growing up in Africa, we do have mental health facilities, but sometimes when it gets to the family level, it is something that is not really talked about. And there is a lot of stigma around mental health, like it is. And again, when someone has mental illness, they don't want to accept that you have mental illness. And sometimes it is being interpreted as something spiritual. With
Mm.
that being said, they go ahead and look for alternate uh, ways to remedy them, which usually does not help the situation. So, how would you advise someone going through mental illness to seek the help that they need if they are going through a denial?
So going back to the denial piece, it's really, really important to identify that you're struggling. A lot of the times we may suppress, and again we are in, it's because of the stigma of mental health that can be really, really traumatizing for people to be diagnosed with a mental illness, and that because of the stigma behind it, there's already, people already have this view or this perception of people that, who may struggle, mentally, that they're crazy, right? That oh my god, this person is extremely crazy. They're not easy to talk to, and again, they have these various subjective thoughts around that. But someone who's, in denial, it's really important to identify it. Don't feel a sense of shame or guilt, because again, everyone struggles, with some form of mental health. But just keeping that in mind, that that one, once you pass that level of denial and being able to identify it, being able to understand, well, okay, well, where did this come from? Understand the history. Is it something that's intergenerational? And if so, how far back does it go? Because it's important to keep in mind that when you're in that sense of denial, it can be quite blinding, because the different signs and symptoms end up becoming your sense of reality, end up shaping your personality, right? So you're not able to really be the true you, or have that sense of true self, because you have literally internalized and now project those various signs and symptoms. So really being able to, one, not be in that sense of denial, but really be able to say, okay, I have depression. Okay, let me look at the signs and symptoms. Let me research and figure out, what is depression? What does it look like? What are things that can cause depression? Once you are able to kind of do that self research, then figure out, well, what are the proper coping strategies that I can use that are healthy, right? So keeping those things in mind, because again, if you've had a long lasting sense of chronic depression, how has it really impacted you over the years, right? So now you have to, get into that groove of unlearning the things that you have learned throughout the lenses of your depression.
Mhm. Oh, that's good. So, talking again about the depression, I would
Mm.
like to bring in the aspect of like culture, religion,
Mhm,
and mental health, how they intersect.
mhm,
So,
mhm.
in our Black community, Christianity or religion is a big thing. So, do you think that the religion and culture has something to do with the way we respond to our mental health?
Mhm. That's a loaded question, but there's a lot of factors, and I don't think I can cover all of it. But in the sense where, yes, culture and spirituality, or Christianity, or even religion, has a huge way in way we perceive mental illness. In the sense where, if prevent you reading the Bible, we've seen that people, are, demon possessed in that sense, right?
Mhm,
And, going back to, having to be happy, to be joyful, to not be anxious, to not be angry, those different types of Bible verses,
mhm,
how has it really helped an individual who may be struggling with anger, who may be struggling with, anxiety, where when they do feel anxious, they feel guilty when they're anxious, because the Bible might, quotes, "Don't be anxious for anything," right? So those are some ways, and again, within the Black community, how people have struggled, where they've had to internalize a lot of pain, a lot of anxiety, a lot of depression, and people have, most likely have had inner negative thoughts where, oh my goodness, I might be possessed, right, by an evil spirit, because of what the Word of God says,
mhm,
right? And because of that, they have not received the proper help, the proper professional help, and a lot of times begin to self medicate because of the embarrassment and the shame and the guilt that's attached to that. So, in that sense, you might find a lot of people might struggle with anger because when you internalize sadness, that turns into anger, right? So they have internalized sadness, anger, maybe perhaps a loss of appetite for the word of God, right? Or any other book, if it's the Quran or any of the books. So in that sense, they have really they have seen themselves in a different way as opposed to living a free and productive life. Now going on to culture has played a huge role in the sense where just the norms and the values and how people have been socialized
Mhm.
within the culture, in the sense where if a person from an Indian background or even an African background had shared with a family member or a close friend, hey, by the way, I am feeling depressed, how would they actually go about receiving that? Would they brush it off? Would they say, what, honestly, be grateful that you live in a country where there's opportunities? Or would they actually embrace the fact that, what, they feel safe enough to kind of share that with me? A lot of the times they get the opposite responses. And because of those negative responses, or responses that are inadvertently shared, because sometimes, again, ignorance is bliss. So again, because
Mhm.
there's a lack of knowledge in that sense, and a lack of understanding, a lack of wisdom, and really taking time to really understand mental health and how it affects people holistically. There's not that support. So of course, within different culture backgrounds, the lack of understanding of mental health, the way that they embrace the individual would not be as safe in the sense where if they understood how it really affects. So now when they see that individual, there's no way you should be depressed. You should be happy that you're alive, as opposed to understanding, what, let me kind of figure out why you feel sad, why you're feeling anxious, or you're anxious because you lost your job. Okay, how can I better support you? Let's find some resources to take care of you in that sense. So you find that because of a lack of understanding, and perhaps with those particular individuals not being able to even take care of their own mental health and to understand their struggles, you find that repetitive cycle continues, and you have a generation of people who are suffering internally and do not have the proper coping skills to cope with mental health.
Wow, you have really analyzed that so well. And I
Mhm,
like the fact that you brought in the historical aspect of our Black community and everything, which really, gives a really better understanding why sometimes we tend not to, take care of our mental health.
yes.
Yes. And
Mhm,
mental health also, I realize sometimes we don't seek mental health or don't admit that people have mental health because it's not something that we see physically.
mhm,
Yeah.
mhm.
Mm.
Exactly. It's more abstract, so that's why people have a hard time in being able to identify. Okay, am I struggling mentally, or is it just my mind playing games at me? And being able to understand how the subconscious mind works. Again, because the subconscious mind, one again, is it's something that we don't know what it looks like, but we know that it truly impacts us. Then we can kind of understand that how everything is so intricate, but it's all amalgamated, and how it really affects one and the same.
Wow. And earlier on, you stated that sometimes our mental health disorder can affect our sleep pattern. But in
Mhm,
everyday life, sometimes when we go to bed, we can't sleep. We just think that maybe we are tired or
mhm,
something like that. We just brush it over and move on. Meanwhile, that may be some kind of symptoms or signs showing that our mental state is not in order. So it's always good to listen to your body,
mhm,
listen to all those little signs and take them very important. Like in our world, one thing I realized, we seek health care only when we are really feeling physical pain. So our mental
mhm,
health, although we may not feel the physical pain, but it is also very important, like you said earlier, to take care of our mental health just the same
mhm,
we take care of our physical health. Wow.
mhm,
Wow. So the next thing I want us to of you to talk about is about the PTSD, which is the post-traumatic stress syndrome. So
mhm,
there's sometimes that is very difficult for people to understand that something that occurred in your life like years ago can still affect your mental state. Like people go through abuse or something like sexual abuse and they don't address it. And it
Mhm.
live with them for a long time and it even affects their well-being. So can you talk about post-traumatic stress syndrome and how it can affect our life, just to educate the people to understand that post-traumatic stress syndrome, sometimes if it's not addressed, it
Mhm.
can go away a long way to distort our well-being.
Mhm. Mhm. Most definitely. Um, so being able, again, with post-traumatic, stress syndrome, it's it's in the sense where it's the aftermath. So it's
Mm-hmm.
not to say that you're experiencing the trauma right now, it's the
Mm-hmm.
aftermath of the traumatic event. So
Mm-hmm.
being able to understand the impact of the traumatic event on your mental ability. So with PTSD, um, one thing is to keep in mind is the fact that it falls under anxiety.
Mm-hmm.
Okay, it's one of the types of anxiety. It's about seven or eight of them actually, and that, I think I had shared earlier that it becomes a mental illness when the anxiety really affects your everyday function. So with PTSD, it truly affects your everyday function in the sense where you experience different triggers. So let's say, for example, a woman had, she had gotten abused, or a man had gotten abused by the opposite sex. Now think about that. Let's say peradventure the lady had gotten abused when she was about maybe 10, 15 years old, right? So the abuse is done. Now she's walking the streets and she smells the cologne of the perpetrator. Now think about that. Her body freezes, so usually you go through this sense where you freeze, you flight, or you tend to fight. So in this sense, she freezes because her body remembers the smell of the cologne, and now she becomes angry. Why is she becoming angry? Right? Those are triggers. Or she might walk into an environment that reminds her of the abuse. It could be even the facial features of an individual, the hair length, the clothes, the height. These different factors can really impact her and lead to various triggers. So PTSD really affects an individual because now they feel stuck. They are not in the present. With trauma, it really keeps you in the past because now you have flashbacks. You might experience nightmares. You might experience even a loss of appetite because you remember the traumatic events that really affected you. Now, in this instance, with trauma, you have to really keep in mind that there are different categories of trauma. There's a plethora of categories of trauma, but the main thing to remember is how trauma really affects your everyday living. These triggers and different precipitating factors really impact how you even interact with people, how you view yourself. Now you feel a sense of shame, guilt, wonder about your worth, and things of that sort. At the same time, you're also thinking about, wow, well, why me? What did I do to really cause this on myself? So keeping in mind that trauma, PTSD really affects you in the sense where it really encapsulates your mind in the sense where it keeps you stuck. And people tend to have a hard time being present because of the past memories and flashbacks that really affects you. And do keep in mind that, again, it's not just a memory, it also affects you physically as well. Where now this particular, go back to the example, this particular individual might have a hard time in her relationships, right? Especially if she's now going to be intimate with her partner, she may have flashbacks of the past. So think about how that really affects her. Or let's say she ends up having children. How would her post-traumatic stress syndrome, how would that really affect her kids? Well, now she might be extremely overprotective, right? Because of her past experience. She may also not allow them to have certain types of friends. They may not be able to, be around certain people. She may have attachment problems as well because of her trauma. So really keep in mind that trauma is a spectrum. There are different types of traumas. There are small traumas as well as big traumas. For instance, even an accident, is a big trauma, but there are small traumas like a dog bite, right? So again, keep in mind with trauma, it's a past memory that really affects how you interact and see yourself as well.
Oh, yeah, that really gives me a better and clearer understanding about how trauma affects, the everyday life of someone who experienced some kind of event that
Mm,
was traumatic to their life. And I think this is going to also help our audience or viewers or family members to understand what their loved one can be going through if they explain to them that they are experiencing something based on their past. Because
mhm,
sometimes, just like rape, when it happens sometimes within the family or close person, uncle rape someone, the family just crush it. They don't want
mhm,
to talk about it.
mhm, mhm.
And
Yes.
it's
Mhm,
difficult for that person to even get the help or support if they don't have someone who can listen to them.
mhm,
So I would also like us to talk about, or you to talk about the intergenerational trauma.
mhm,
So I've seen, I mean, there are people who live in our society, we think they have it all, though mental illness is not something that we can detect just from seeing someone. But how do intergenerational trauma affect someone? Let's say, actually, what I want to ask precisely is that is trauma something that can be, or mental illness, is it something that is hereditary that can be passed through generations?
mhm, mhm.
Yeah, so let
Yes.
us know.
Yeah, yeah. So with mental illness, it's something that can be hereditary. It can be passed down from generation to generation. Now, for the most part, keep in mind there are about three. Again, there's more, but there are three different types of causes of mental illness. One being biological. So keep it in mind that, for instance, that goes under the category of genetics, being hereditary, where a person can experience a mental illness because of, grandparents, great grandparents, and going as far back as even, as far back as the first people on earth, Adam and Eve. Um, but with intergenerational trauma, keep in mind that, again, if it goes undiagnosed or unrecognized, it now becomes the norm within that family. So this is where we say, oh this is where we say, well, this is a cultural thing now. My family, we all get very angry, we all feel very anxious. Well, you have to look at these different things as intergenerational trauma. How has that really been passed down from generation to generation? Now, keep in mind that there's something called epigenetics, and this is something where if a woman is pregnant, she can definitely experience this in the sense where her trauma can be passed down to the baby. And now the baby, once the baby's born, can definitely experience these exact same symptoms that the mom has also experienced. That's another way that trauma can be passed down. So keep in mind that once again that if these traumas do not go recognized, you may definitely have some problems in that sense. Now, with intergenerational trauma, once again, it looks different within each family, within each household, but you might find that, that they have similar different types, similar mannerisms, similar behaviors, similar ways of coping, similar ways of, where they might have similar defense mechanisms. So these sometimes can be because of trauma, in that sense. And again, sometimes you can only dish up what you know. So a lot of the times, because people aren't really educated in that sense, they don't really have much advice to really, pass on to the next generation, and that's how we continue to get these perpetuated personalities, and again, these perpetuated characteristics.
Oh, wow. That's good. So if, let's say, talking about intergenerational trauma, is there any way that it can be controlled?
Hmm. Well, again, the biggest thing is educating yourself, taking the time to understand what it is. I would definitely say, subjectively speaking, look at your family tree, look at your family history. Do you find that, within your family, you all tend to get extremely anxious under pressure? Do you find that you guys tend to pace back and forth when you are under pressure? Do you find that, when life is really hard, you tend to withdraw? Right? Do you become depressed? Do you find that, when certain things happen to you, you get very angry? So start to look at the various characteristics within your family,
Mhm.
especially, when dealing with certain things with people. Do you find that, when somebody hurts your family, do you guys tend to cut them off? Right? So really, really taking, things in mind where, again, if within your family, people get hurt, how do they treat people? This goes back to trauma, right? When you experience an event, what happens? What's the aftermath of the trauma? So keep in mind that those are things that you have to really consider in that sense.
Oh, okay. So one last one I just thought about is bipolar disorder. How
Mhm.
do we treat people who have that bipolar disorder?
So with bipolar disorder, the reason why it's called bipolar is it's two polar opposites. So with bipolar disorder, there's the manic state where an individual can be extremely, extremely elated. That they can be, they can shop like crazy. They might, they're just super hyper. But on the contrary, when things are a little bit more difficult, they do experience a sense of depression as well. So there's always those two polar opposites. Very rare is a person, very rare do they experience them simultaneously. But for the most part, they can be, super excited, super hyper, and that's where they have experienced the manic state, and then again go back to the depression where they experience low states. So in that sense, the best sort of thing to support an individual is once again being there for them when they're in that depressive state, understanding what bipolar is, knowing that it's two polar opposites, and that person experiences sense of um, hyperactivity, and at the same time they experience low experiences as well. So keep in mind that again, they will need that support when they are in that manic state where they're super excited and they're doing crazy things. For instance, shopping like crazy, spending money that they don't have, reminding them like and kind of bringing them back to reality, because sometimes they might end up losing that sense of focus and going into a different realm where they just start shopping like crazy, and because of that polar, they sometimes might lose a sense of reality, so kind of bringing them back. And on the contrary, when they do experience that depressive state, reminding them that they're loved, that they're cared for, that they do have a sense of value, and again, that could look different amongst all people, whether it's physical touch or it could be, some sort of an encouragement, but really reminding them of their value and their self-worth, because in that depressive state, like I stated before, they do experience a sense of helplessness and hopelessness, and they feel like there's nothing to live for. So that's the best support that they can give.
Wow. Samantha, this discussion has been so interesting. I have learned so much, and I know for sure that the audience are going to learn a lot from this discussion for today. Mental health, like we said earlier, it is so important. It is
Hmm.
something that is, we have to take care of it just like
Hmm.
we do to any kind of health condition. So you've outlined so many important mental health disorders that are existing, and also some of the signs and symptoms to look for, and also how to take care for your loved one with mental health illness. So there's no shame around the mental health, because this is something that it can happen to anyone. So
Hmm.
it's good to
Hmm.
support those who are going through mental health challenges, give them the best support you can, and
Hmm.
help those who need help. Because some people, they go through the mental health without even knowing. And you, as a loved one, as a support system, it is
Hmm.
always listen to them, direct them to where they can get help. So, with all this being said, Samantha, do you have some resources that you can share to the audience? Like someone, for example, who is going through mental health challenges right now, where do they seek help? How can they get the support that they need?
Hmm. So there's a plethora of resources throughout, again, Toronto and things of that sort. Some of them are actually international, but they can definitely contact, Black Mental Health Canada. That's another great resource. Black Women in Motion for women, who are struggling mentally. Black Youth Helpline, wellness therapy across borders, Arise Mental Health Services, which is my business. Again, they are more than welcome to contact these various resources who are more than willing to cater to people who are struggling with mental health. I mean, they understand just the stigma behind it. They understand, the struggles that many, again, once again, Black people face within this North American society. So they understand in that sense. So it is sometimes great to, again, look in on a broader scope of other resources, but it sometimes really helps being able to kind of get that support from your own. So those are just some of resources as well. There are some books that I would also recommend. One being Post-Traumatic Slave Syndrome by Dr.Joy Degruy, one of my favorite books. She talks about the impact of how slavery has really impacted us as a Black people and how we actually still embody the trauma of our ancestors. And again, how we have actually socialized our trauma within our families. Another one is How to Do the Work, one of my favorite books by Dr. Nicole LePera. She talks about the trauma and she also gives you different activities to do to work on your trauma as well. Another one is Black Families in Therapy. There's a book called The Power of Your Subconscious Mind by Dr. Joseph Murphy, one of my favorite books, and how the subconscious mind really impacts you as an individual. For example, if you're doing the dishes, you might have different thoughts and you might find that your demeanor changes. Well, that's your subconscious mind working, and how your subconscious mind really encapsulates everything in that sense. So these are just some of the books that I would recommend people reading. And again, there's other books out there as well. There are a lot of audiobooks as well on Audible that can really really impact and help people in being able to understand who they are as a person. There's another book called, I think it's called The Unapologetic Guide to Black Mental Health. Very good book as well. And again, these are just some books. And another book is, I think it's called The Power of Habit as well. Very good book by, I think, Charles Duhigg as well. Very good books that I read. So those are just some of the recommendations.
Wow, thank you so much for these resources and also the books. I love to read books, so I'll post them down below and I'll also check some of the books to read. Thank you so much, Samantha. It's been such a pleasure having you here.
You're welcome.
You have really shared your wonderful experience and expertise knowledge that I know it's going to help a lot of people watching this. So thank you so much for coming by. Thank you so much for taking the time of your busy schedule to be here today to share this very, very vital knowledge. Thank you, Samantha.
You're very welcome.
Okay. So, everyone, I hope you enjoyed the discussion for today. That is Samantha Frederick, our mental health expert who's been working with mental health for over 10 years. So, thank you all for watching. So, this channel is just all about empowerment, uplifting. And if you enjoyed this video, please share the video, click the like button, comment, and also subscribe to this channel. Let's join together and save one life at a time. Thank you, and I will see you in the next video.